everyone, and welcome back to my YouTube channel. I am Sarah Lavonne, and today we are going to be talking about how to choose a care provider for your labor and birth. That could be a doctor or that could be a midwife. The reason for this video today is actually because I had been on the LA Mommies Facebook group and I've been seeing over and over again people asking for recommendations for a doctor. There was one in particular that had commented about choosing a doctor at a hospital that I have worked at, and so I made a comment, hey, I'll help you choose your top 3 based on the 300 and some comments that were on this blog, and then reach out to me and I'll help you find the right fit for you. And that goes for anybody else. And so what happened was within about 2 days, I had 15 messages in my inbox of women trying to seek help on how to choose a care provider. I know choosing a care provider is a big decision. They are allowed into this special moment of your life. They can potentially make or break your experience. And so it is important that you choose wisely, and that is a decision that you do have control over. So I'm here today to help you know how to narrow it down, how to maybe come to a decision, and what are some of the things that you should consider when choosing who you're gonna deliver with. So let's get started. Okay. I hope I don't look dead. Feel a little dead. I just did a video called the 5 tips for labor, birth, and life. And in one of those, it was choose your doctor wisely. So we're gonna take that one step deeper today. First of all, before you choose your doctor, you need to look into your insurance. Decide whether you're gonna pay out of pocket, it's gonna be cash pay, or by your insurance. Because especially if you have insurance, you need to be using a doctor that's within your network so you don't get hit with a bill that's a lot of money. Once you decide if it's insurance or out of pocket, if you're paying cash, most doctors are gonna take you. There are doctors that are cash pay only. The cool part about cash pay only, if you have the money, is that you're probably gonna get a little bit more time with your doctor. I'm not gonna say better care, but you likely will get more time with your doctor. That being said, you still will get time with your doctor. You still will be able to cultivate a relationship with them. So once you check your insurance, you get a list from your insurance provider of these are the doctors that I can go to. You also, in the meantime, want to decide whether or not you want to deliver in the home or in the hospital. This could be an entire other video. Do you want to be delivered by a midwife, which is going to be more of a home birth atmosphere? Or do you want to be delivered by a doctor, which is going to likely be more of a hospital atmosphere? I will just make a disclaimer that not every patient or mom that wants to deliver at home is actually a candidate to deliver at home. You have to be considered low risk in your pregnancy and not have any complications going on. So if you have a pre-existing health problem, you can probably just assume that a home birth is not going to be an option. You'll have to deliver in a hospital. But there are midwives that deliver in hospitals, and there are midwives that function in hospitals as well. So that's just something to keep in mind. The other thing you want to think about is there a certain hospital that I want to deliver at? I know in LA there's like a lot of hospitals out here, but in other towns there may not be a lot of options for hospitals. Maybe there's 1 or 2. So that's where maybe you've heard from other parents or friends or family members which hospital is better based on what they've told you. And there might be a hospital that you really want to deliver at. So that I would look at the providers that have been given to you by your insurance and then compare that to what hospital they have privileges at. Just because they're a doctor in LA doesn't mean that they can deliver at every hospital. They have to go through a whole long process to give them privileges to be able to deliver in that place. The other thing you want to consider is where is the location of the doctor's office, because in the beginning you're not really seeing them very much, but towards the end of your pregnancy you could be seeing them 1, 2, 3 times a week. And then also how far away is the hospital, because for some it's really important that they're very close, so if they go into labor they can labor at home longer versus having to deal with like an hour, 2-hour car ride. Then you're gonna decide between male or female. There's actually a lot of female obstetricians, because I think for a lot of women they do like the idea of having a woman take care of them. You also have the option of delivering with a male. So you may have a preference one direction or the other, and that's going to eliminate a whole section of doctors that you can deliver with. This is complicated. So now that you've eliminated all of kind of the outside factors, then you want to really think about that particular doctor. So first of all, maybe on your list, you've eliminated it down to after you do the whole male-female thing, that maybe there's like 3 or 4 doctors that are left on your list. I would really suggest asking your friends and family if they've heard of anything, and then look them up on Yelp. Look them up on healthgrades.com. Those are two websites that, I mean, I've been on and I've looked up doctors that I've worked with, and they are pretty accurate based on what the experience is with the doctor. Now, what I will say as a disclaimer for anything you find online, most of the time, anybody who's gonna write a review and take the time to do that, they're either gonna have one extreme. They're gonna have had the best time of their life. They love their doctor. They wanna marry their doctor. Probably don't want to marry their doctor. They love their doctor, and then there's the other extreme where they had a horrible experience. And so what I would say is take those reviews and kind of hold loosely to them and say, okay, so I'm hearing you say one thing this way, but what does the majority say? What's kind of the overall feel of this doctor? Versus listening to one person who had a horrible experience. And maybe that was outside of their control. Maybe it was inside their control. But most of the time, those Yelp reviews or health grades will give you sort of an idea of the feel for the doctor. So you've gone online, you've looked them up, you have your list of doctors. Then the other consideration would be how much experience they have. So there are lots of new doctors, there's lots of old doctors and everything in between. And when I say doctor, I also mean, it could mean midwife as well. You may prefer somebody on the older side that's been around and seen all the changes for the last 40 years. Or you may prefer somebody who's a little bit younger, fresher, quicker, with a little more energy. No offense to my older doctors out there. But it's kind of based on what your feel is. Let me just say that anybody who's functioning as an independent doctor has passed their boards. They are an MD. Now, mind you, I would check to make sure that they do have their MD, their licensure. And then the other side note would be if they're board certified. Board certification takes an extra exam, an extra time. You want somebody who's an expert in their field, who's done lots of work to set the foundation for taking care of you. Now you really want to get into how does that doctor feel with you? So before we get there, I want you to think about what's important to you for your labor and birth. Maybe you know that you absolutely want an epidural, you absolutely bring on the drugs, I have no preference for that. Do whatever you want. I just want a healthy mom and a healthy baby, which is the goal anywhere you're gonna be. Then I would recommend sitting down and thinking about what's important to you in a doctor. Do you want somebody who's gonna be super smushy gushy, rub your head, hold your hand in labor, or do you prefer more of the like drill sergeant, yeah, we're doing it, that like kind of tells you what to do, is pretty forceful about it, maybe a little rough around the edges, but gives it to you straight. I've had patients and doula clients that have preferred anywhere on the spectrum, where some really like that they just like tell you how it is, and then the other ones really like that, like them to be really soft and loving and nurturing. And so there are obstetricians and midwives that are anywhere along that line. But what's important to you as far as their demeanor goes? What are your expectations of them in labor? How much do you want them to be present? Some doctors will only be there to catch your baby. Some doctors will see you in the office and then they won't actually deliver you. So those are some questions to consider. And then what type of birth experience are you looking for? Do you want one that is super natural, that is not medicated, where you labor at home as much time as you can without interventions? And somebody who's going to be really trusting in the labor process and just kind of go with the flow based on what you want? Or do you not care? Kind of like that epidural mom that I talked about before. And anything in between is totally fine. It's completely up to you and it's your experience. So, but that experience that you would like and those preferences and values that you have for your labor and birth are likely going to dictate what type of doctor that you choose. So once you've determined what's important to you, then I would say is to set up a meet and greet with the doctor. So you would call the office and say, hi, I'm looking / I would say shopping for a doctor. I'm shopping for a doctor, or I'm trying to determine what doctor will be a good fit for me. Maybe you're pregnant now, maybe you're looking to get pregnant, and you would ask to sit down with them. And then you would come prepared with those questions of how do you feel about cesarean birth versus vaginal birth? What is your C-section rate? All the time I get asked, what's the C-section rate of the hospital? And really what matters is not the C-section rate of the hospital. What matters is the C-section rate of your doctor. If you're really looking for that vaginal delivery, you're gonna wanna go to a doctor that has a low C-section rate versus a doctor that 80% of their patients end up with a C-section. Guess what? If you choose this doctor, likely 80% chance is that you'll end up with a C-section. So that doctor really does determine and make a difference in the outcome potentially for you. The other thing you want to consider is what your preferences are for the way that you labor and birth. And then you want to find a provider that's going to match up with those labor and birth preferences. For example, maybe you really want to be on all fours when you push the baby out. Some doctors are gonna feel very comfortable doing that, and other doctors may not feel as comfortable doing that, and they may prefer you to deliver in what's called a lithotomy position, which is like your typical like legs back type position. And so when you come to your doctor and you're able to talk about those preferences ahead of time, you're able to determine if they're a right fit for you. And then last but not least, what I would say is you have to be able to trust your doctor. I know I've said this, I will continue to say this, but your relationship with your doctor is so important, not only for your birth experience, but also for the labor. That when you feel safe, when you feel like they're on your side, you're gonna labor a lot more easier than one where you feel like you're fighting the system the entire time. And so it is your responsibility to choose wisely, hence why I put that in the previous video as one of my 5 top tips. How many times that you meet somebody or you sit down, maybe you're on a blind date, and you know immediately if you're comfortable with the person. I know there's people that I've met where I'm like, we're gonna be friends for a long time, even on the first time that we meet. Whereas other people, maybe you're on the phone or you sit down with them and there's just kind of this awkward back and forth. You're not really sure what it is. You wanna find somebody that you feel super comfortable with, that you feel like you can ask every question to. They're not gonna make you feel stupid when you ask any question, because really it is your birth experience that you have to live with for the rest of your life. Their demeanor and the comfortability that you have with your doctor is really, really important. And so trust your instinct with that. And again, that brings me back to that 5 tips for you, is to trust your instincts, that you know what's right for you. In that meet and greet, then you get a feeling for how comfortable you are with them. Are they somebody that you could see allowing them into that special moment in your life? And then when they are, then you have found your doctor. To recap once again, look at your insurance, out of pocket, cash pay not, doctor versus midwife, home birth versus hospital birth, location of the hospital you want to deliver at / where their doctor's office is, experience level, male versus female, and then really what it comes down to is what's important to you for your labor and birth, what type of demeanor is important to you, or how they act, what their personality is like, how open they are to different things that you're looking for. And then ideally you have found a doctor that can respect you and listen to what's important to you, and then you both together can come to a mutual consensus. As things go different ways in your labor, then you can come to an agreement, and ultimately you can make those decisions for you in your labor, and you can feel super safe and supported by whoever you choose. Thanks everybody for being here with me today. I have a list of over 100 topics that I am so excited to bring to you related to childbirth education and parenting, maybe some baby care thrown in there. And so stay tuned for more videos to come. Please feel free to comment below if you found something helpful. If you have any other ideas for videos, I know I said I have a list, but if you have something where you're like, yo, I need this information now, please write it below, and then don't forget to subscribe, and I look forward to seeing you later. Happy New Year, everyone. Put your headphones on. Okay. Hello, and welcome back to my channel. It is a Happy New Year. No. I just recently did a video that were the 5 things and what was it? No, I should know the name of my own video. So now you've limited it down. No. So now you have eliminated, what am I trying to say? Okay. So now you've wet it down. Now you've weeded it, you weed it out. But I have to sneeze. I look forward to hearing from you, and until next time, Happy New Year. Happy New Year. Happy New Year. Happy New Year. Happy New Year? Is it really still a Happy New Year? What is it today? I don't even know.